Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a nephrologist talking to a patient named Laura Thompson, who has been recently diagnosed with IgA nephropathy, called Buerger's disease. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. Your GP referred you to me so we can discuss your recent diagnosis of IgA nephropathy, also known as Buerger's disease. How are you feeling today?
Honestly, doctor, I'm still trying to wrap my head around it. I've never heard of Buerger's disease before. When the GP mentioned it, I was shocked. I've always been healthy, and this seems so out of the blue.
I completely understand. IgA nephropathy can be quite overwhelming to hear about, especially when it's something unfamiliar. Let's start by discussing what it is and how we can manage it. Can you tell me about the symptoms that led you to see your GP?
Well, it started with me noticing blood in my urine a few months ago. It wasn't every time, but it was enough to make me worried. At first, I thought it might be an infection or something minor. But when it didn't go away, I decided to see my GP. They ran some tests, and that's when they found the problem with my kidneys.
Seeing blood in your urine, known as hematuria, can definitely be alarming. It's one of the more common signs of IgA nephropathy. Did you experience any other symptoms, like swelling in your legs or high blood pressure?
Now that you mention it, yes. I've noticed my ankles have been more swollen than usual, especially in the evenings. And during my last checkup, my GP said my blood pressure was higher than it should be. But I didn't think much of it at the time. I thought it was just stress from work.
These symptoms are typical of Buerger's disease. The condition involves the buildup of IgA antibodies in your kidneys, which can cause inflammation and damage over time. It's good that we caught it when we did. With proper management, we can slow down its progression.
That's a relief to hear. But what kind of treatment are we talking about? Is it medication or something more serious like dialysis?
The treatment varies depending on how advanced the disease is and how much your kidney function is affected. In your case, since we've caught it relatively early, we'll start with managing your blood pressure and reducing the inflammation in your kidneys. We'll likely prescribe an ACE inhibitor or an angiotensin receptor blocker to help protect your kidneys and lower your blood pressure.
Okay, that sounds manageable. Are there any side effects I should be worried about?
Most people tolerate these medications well, but like any medication, there can be side effects. These might include dizziness, fatigue, or an increased potassium level. We'll monitor your blood work regularly to ensure everything stays within a safe range. If needed, we can adjust your treatment plan.
That makes sense. I'm willing to do whatever it takes to keep this under control. But doctor, what does this mean long term? Will I need to take these medications forever, or is there a chance the disease will go away?
IgA nephropathy is a chronic condition, which means it won't go away completely. However, with the right treatment, many people can manage their symptoms and maintain good kidney function for many years. We'll also discuss lifestyle changes, such as reducing salt intake, eating a balanced diet, and possibly limiting protein, which can help reduce the strain on your kidneys.
I'll do whatever I need to. I just want to avoid things getting worse. I've read that some people end up needing a kidney transplant. How likely is that?
It's true that in some cases, IgA nephropathy can lead to kidney failure, which may require dialysis or a transplant. However, this doesn't happen to everyone. The goal of your treatment is to prevent that outcome. By staying on top of your health and following the treatment plan, you have a good chance of maintaining your kidney function for many years.
Thank you, doctor. I feel a bit more at ease knowing there's a plan in place. I guess I was just scared because I didn't know what to expect.
It's completely normal to feel that way, but remember, you're not alone in this. We'll work together to manage your condition, and I'll be here to support you every step of the way. Do you have any other questions or concerns?
Not right now. I just want to focus on getting better and staying healthy.
That's the right attitude, Mrs. Thompson. We'll set up a follow-up appointment in a few weeks to see how you're responding to the treatment. In the meantime, if you notice any new symptoms or have concerns, don't hesitate to reach out.
I will, thank you, doctor. I appreciate your help.
You're welcome. Take care, and we'll talk soon.
Extract 2, questions 13 to 24. You hear a GP talking to a patient named Mr. Foster, who has concerns about excessive hair growth. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Foster. I'm Dr. Stevens. I see you've come in today to discuss some concerns about your hair growth. Could you tell me what's been happening?
Good morning, Doctor. Yes, it's something that's really been bothering me. Over the past year, I've noticed excessive hair growth all over my body. It's not just in the usual places, it's on my face, back, and even my hands. It seems to be getting worse, and I'm not sure why.
That does sound concerning. You mentioned it started about a year ago. Have you noticed any particular areas where the hair growth is more pronounced or any changes in your routine around the time it began?
It's pretty much everywhere, but the hair on my face and back is the thickest. I haven't changed much in my routine. I thought it might be a reaction to something, but I can't figure out what it could be.
When did you first start noticing these changes? Has anything about your health or medications changed around that time?
It was about 12 months ago. I did start a new medication for my high blood pressure around that time, but I'm not sure if it's related. Other than that, nothing else has really changed.
Some medications can cause an increase in hair growth as a side effect, but it's usually more localized. Given the extent of your symptoms, it might be something more complex, possibly a condition called hypertrichosis, which causes abnormal hair growth in areas where hair is not typically prominent.
Hypertrichosis? I've never heard of that. What causes it?
Hypertrichosis can have several causes. It might be hereditary, meaning it runs in families, or it can develop due to other factors such as medication, hormonal imbalances, or even as a symptom of a more significant underlying condition. We would need to explore these possibilities to determine the cause in your case.
I see. Is there a way to diagnose it and figure out what's causing it for me?
Yes, we can start by running some tests. We'll likely do blood work to check for hormonal imbalances and review your current medications more closely. We might also look into your family history to see if there's a genetic link. Depending on the results, we can discuss treatment options that could help manage the hair growth.
That sounds like a good plan. I'm really hoping to find some answers. It's becoming difficult to deal with, both physically and emotionally.
I can imagine this has been challenging. In the meantime, have you tried any methods to manage the hair growth, like shaving, waxing, or other hair removal treatments?
I've tried shaving, but it grows back quickly, and it's really thick. I've also tried waxing, but it's painful and doesn't seem to last very long. It's like nothing I do helps, and it's affecting my self-esteem.
That's understandable. There are other options, such as laser hair removal or prescription creams that can slow down hair growth. However, these treatments are more effective when we know the underlying cause. If we find that the hypertrichosis is linked to your medication, we might consider adjusting your treatment plan to see if that helps.
I would be open to trying new treatments, especially if they could give me longer-lasting results. How long would it take to see changes with these treatments?
If we try something like laser hair removal, you may start to see results after a few sessions, but it can take several treatments to achieve significant reduction. Prescription creams can also take a few months to show noticeable changes. However, it's important to remember that the effectiveness varies from person to person, depending on the cause and the severity of the hair growth.
Okay, I understand. I'm willing to give it a try. I just want to feel like myself again.
That's completely reasonable, Mr. Foster. We'll take it step by step. First, let's run the necessary tests to pinpoint the cause. Then we can develop a treatment plan that suits your needs. I'll also provide some guidance on managing hair growth in the meantime to help you feel more comfortable.
Thank you, Dr. Stevens. I really appreciate your help. It's been a tough time, and I just want to find a solution.
We'll work on it together. I'll arrange for the tests, and we can meet again once we have the results. In the meantime, take care and try not to worry too much. We'll find a way to manage this.
Thanks, Doctor. I'll do my best. I'm looking forward to getting some answers.
You're welcome, Mr. Foster. We'll get to the bottom of this. See you soon.
See you, Doctor. Thanks again.